Introduce yourself.
I'm Hattie.
Hi, Hattie. So Hattie's one of our junior doctors at Queen Vic East Grinstead, and I'm going to demonstrate how to reduce a TMJ dislocation. We've got a model here to demonstrate what typically happens for these patients. They could have a predisposition, something like Ehlers-Danlos syndrome, for example. It's quite unusual to dislocate, and it can be a recurring problem for a lot of patients. There's a psychosomatic element to that as well for some patients. But so a TMJ dysfunction, typically, you've got the head of the condyle here on the skull, and there's the articular eminence. Normally, when you open your mouth, you rotate and then slide forwards. But when that forward slide is beyond the articular eminence, you then are in that position. And these patients will then often present with a mouth open position, unable to self-reduce. And it's extremely painful, lots of muscle spasm. It can be unilateral or bilateral. An X-ray will help to diagnose it, but the characteristic feature is that the mouth is in that kind of an open position and not able to close. So one of the strategies to reduce, you can give somebody just some good analgesia, non-steroidals, and a muscle relaxant, midazolam, and the chronic dislocators will reduce back in spontaneously. If they don't, you will need to reduce that yourself in A&E. The best position to do that is from the front, and I'll demonstrate how to reduce that. So Hattie, if you could hold that skull for me. So if they're in this position, get a good grip of it, because I'm going to pull it down. Got it? So they're in this position here like that, with the TMJ dislocated. What you want to do is put your thumbs in the mouth, onto the molar teeth, both sides, and you want to push down, get it over the eminence, and then it should clump back in. So let's demonstrate that again. That's the position they're in. You push down, push down, push down, until you get it through, and then in and close the mouth, and then wait until that muscle spasm settles down for them. So I'll show you that technique from both in front and behind on Hattie. So in front, we would, with some form of muscle relaxant, and if you open for me, so it's pushing down on the molar teeth, and you want to tip the chin and push down, and then it'll plonk in, and then you close the mouth as it does that, and you're in. So there's a good deviation you can see on Hattie's mouth closing as well. The other way to do it is to go behind the patient. So again, if you open your mouth for me, Hattie. So behind the patient, again, I'm pushing down with my thumbs in the molars to try to get the mantle over that eminence, and then push in, and then we'll close here in, and that's how you reduce it from behind. So that's how you reduce a temporomandibular joint dislocation.